No two fibro patients respond to treatment the way we'd like. And what we see and what functional medicine looks at is fibromyalgia is a result, an outcome or a destination, with many potential roads or alterations in physiology that contribute to that destination. So it's not one biochemical pathway gone awry, it's slow, steady alterations in physiology. So there's now 10,700 research papers that have tried to identify potential causes of fibromyalgia. We've got essential fatty acids that have been helpful, we've got B12 that's been helpful, we've got L-carnitine, we've got NSAIDs, we've got SSRIs, and so on. So how do we know what to apply to each patient? Well, functional medicine allows us to put this into a framework that helps us identify what alterations does this patient have leading to fibromyalgia? What are their subtle physiological shifts that have occurred over time that contribute to this pathology? The primary dietary signals, some of these patients that I've seen, and there's a few papers in the literature that have shown they've done extremely well with dietary changes. The hypoallergenic diet, 76% reduction, reported reduction in symptoms such as headaches, fatigue, bloating, heartburn, breathing difficulties when you take problem foods out of the diet. And we know that fibromyalgia patients have an altered or a damaged stress response. And what functional medicine is able to do is help to restore that. We'll look at the gastrointestinal balance, xenobiotics and biotransformation balances in the liver, immune. So these patients have damaged mitochondria in the muscles and the nervous system. We see disruptions in cortisol, DHEA, growth hormone, and melatonin. Underlying causes that might be contributing to this. Immune abnormalities, we see an imbalance in inflammatory cytokines during flare-ups with these patients. Food intolerances, low-grade viral infection. So now we see a connection between immune imbalances and inflammatory disorders contributing to excess glutamate in the central nervous system. Sometimes instead of just blocking the final result, which is glutamate, we might want to look at what's causing the excess glutamate. And we know that stress or a hyper-HPA, hypothalamus pituitary adrenal axis, a hyperaxis, can cause excess glutamate production. Heavy metal toxicity, this is a subject that's near and dear to my heart. So there is a small study that shows that 9 out of 10 patients with fibromyalgia have mercury toxicity. And finally, detoxification, big part of my practice. All fibromyalgia patients are toxic, and it's just a matter of how toxic. Now, tryptophan, of course, being a precursor to serotonin, there's a link between serotonin and cortisol, where patients who have altered cortisol production have lower levels of serotonin. So we now have a potential reason why these patients are not producing or low in serotonin. Chronic candidiasis, dysbiosis, where patients with chronic fatigue, their anxiety improved when they were given particular strains of probiotics. So there is a huge gut sort of brain connection there, and they don't respond well to stress. It's like their autonomic nervous system's on overload. And we're going to talk about how we can break that down and restore these patients' stress response. Finally, there's some vitamin and mineral deficiencies. So that's why patients get fibromyalgia. This is the web of physiological factors that leads to that outcome. Going through all of the literature, these are the areas that have been identified to contribute to this outcome. It's really important to understand Dr. Sidney Baker has a TAC rule. And that TAC rule is if the patient's sitting on 2 thumbtacks, usually these patients have a lot more underlying causes than just 2. If you take away 1 thumbtack and they're sitting on 2, they don't get 50% better. So what you have to do is you have to influence the entire web, not just treat one system in isolation. Because it takes time to evaluate, find their underlying causes and get better. But the ones that stick through it often do dramatically better. So my recommendation is if you want to start using integrative medicine, use the meds that help them feel better. And then start looking at their underlying causes. If you combine the two together, I think we're going to get much better results with these individuals. So treatment, is there a more effective way? And I think integrative strategies help us pave the way to a more comprehensive integrative approach to helping these patients get well. you.